Some important distinctions to make is that for the RPG-2 grantees, that they are required to implement evidence-based programs and trauma-focused or trauma-informed services. They're also required to specifically address child well-being as a part of their program, services, and activities, to conduct a rigorous evaluation to further establish the evidence base for these interventions, and also to participate in a national cross-site evaluation, collect and report on required performance and evaluation measures. The RPG-2 grantees continue to be supported by the National Center on Substance Abuse and Child Welfare for programmatic TA, and the National Center is funded through an interagency agreement by ACF and SAMHSA. With the Round 2 legislation, we were also able to award a contract to Mathematica Policy Research and their partners to conduct a 5-year cross-site evaluation. And information on both the RPG-1 program and the RPG-2 program can be found on the National Center website. I think in talking about the background, we really also want to note a couple of other things about the authorizing legislation. And one is that this program required that HHS establish a set of performance indicators through a consultative process. And these performance indicators are used to periodically assess the grantees' outcomes. The second thing that we wanted to highlight from the legislation is that it focused on 3 key areas, and that we had to report through an annual report to Congress on the services that are being provided by the grantees, the performance indicators that I just mentioned, and then the overall progress that's being made to address the needs of these families, those that were impacted by methamphetamine or other substance abuse who have come to the attention of child welfare, and progress that has been made in achieving the goals of safety, permanency, well-being, and recovery. Support for the RPG-1 grantees, we were, as I said earlier, at the same time of awarding the grants, HHS also awarded a regional partnership support contract to Children and Family Futures. And with their partners, Planning and Learning Technologies, or PALTech, and ICF Macro, they were able to carry out many tasks, but I'll just highlight the ones that you see on the slide here, which are to refine and finalize the set of RPG performance indicators that are used to monitor the grantees' progress. They developed, through the consultative process, a web-based system to collect the indicator data, which Ken and Chad will talk more about in a little bit. And then also to provide technical assistance and training on evaluation and data-related issues, as well as those programmatic issues regarding child welfare, substance abuse treatment, cross-system collaboration, funding and sustainability, and other related issues. As you can imagine, with a diverse set of 53 grantees, there were many challenges. And so this group really is to be commended for the effort and perseverance that they put in to effectively address the grantees' TA and support needs. The way that we were structured was each grantee was assigned or a performance management liaison, as they were known, and the PML and the federal project officer worked together to communicate with the grantees and had on-site visits and really developed working relationships from the beginning of the project. On this next slide, we want to just highlight, again, in framing the discussion, the RPG program purpose. As I said, it was a diverse group, and so with that, the grantees addressed a variety of common systemic and practice challenges that are barriers to optimal family outcomes. Things like recruitment, engagement, and retention of parents in substance abuse treatment, differences in professional perspectives and training, conflicting timeframes across systems to achieve outcomes, and chronic service shortages in both child welfare services and substance abuse treatment. And so with that, We hope today that we can illustrate the successes and challenges established in sustaining cross systems that the grantees were able to do, to highlight how through the program we were able to see an increase in well-being and improve permanency outcomes for children, and then also the process and outcomes that the grantees use to address the complex needs of families, and really how we are communicating those successes to the field and to others of interest. And so thank you for your time, and at this point I would like to turn it over to Ken DeCercio.
Thank you, Elaine, and welcome everybody. I too would also like to acknowledge the individuals and organizations that Elaine mentioned at the outset of the webinar. Certainly appreciate, Elaine, your leadership as our Federal Project Officer, the support of Catherine Nolan as the Director of the Office of Child Abuse and Neglect, and Sharon Amateti's support at SAMHSA going back to 2007. We were all trying to figure out how to implement the Regional Partnership Grant Program. Certainly want to recognize all the staff at CFF who put a lot of energy and hard work into supporting the grantees throughout these 7 years. And also, finally, there were 53 regional partnership grantees. There were times when we used to talk about only being a little bit ahead of the regional partnership grantees when we were beginning to implement this program. And there were times that some of the grantees were ahead of us. But through their hard work in implementing the project and in reporting the information and certainly the data collection, we're able to bring you and share with you their experiences as well. In this next segment, I want to briefly describe the regional partnership grantees and their partners. The lead agencies of the 53 grantees represent 29 states and include 6 tribes. State, county, or tribal child welfare agencies were a partner in all 53 grantees and all 53 partnerships, and that was required by the legislation. Slightly less than half, about 45% of all the partnerships have a child welfare agency or child welfare services provider as a designated lead agency. All the partnerships had a required lead agency, who was the applicant agency, had a requirement to have child welfare agency, either the state agency or their county representative, as a partner in the regional partnership grantees. Nearly 1/4 of the lead agencies were substance abuse agencies or treatment providers. The remaining types of lead agencies were child and family services agencies, other types of community resources and providers, as well as there were several courts, Office of Court Administration as lead agencies, and as I mentioned earlier, tribes. These regional partnership programs served participants in over 180 counties, and approximately 1/3 of these counties were rural. You can see on this next slide there's a map of the location of the regional partnership grantees. As Elaine mentioned a few minutes ago, the RPG-1 program included a focus on families affected by methamphetamine, which had been driving out-of-home care placements back in the late 90s, continuing through into the mid-2000s, and certainly was a huge issue in 2006 when this legislation was passed. So as you can see from the map, there were more grants funded in the Midwest, Southwest, and West, including Alaska. In fact, about 38 of the 53 of the grants that were funded came from either the Midwest or farther out in the United States. In the geographic areas served by the grantees, almost all of the grantees provided services to families in a specified region encompassing multiple counties or a single county in their state. The regions varied greatly in scope from 2 to 20 counties, and the programs addressed methamphetamine as well as other types of substance abuse impacting their regions and target populations. Most of the grantees served families with children who remained in their home, as well as children who were removed from their home as part of, in response to a substantiated abuse and neglect. This next graphic reflects the RPG member agencies who are partners with the lead agency. The regional partnerships, as defined by the legislation, must be entered into by at least two partners, as mentioned a few minutes ago, one of which must be the state child welfare agency. And this these next three slides begin to both the depth and the breadth of the partnerships. The partnerships extended well beyond child welfare, substance abuse, and the courts to include other service systems and community organizations such as mental health, housing, employment, and the schools. And as you see here, family drug courts, attorneys, and other court representatives. And during the last year of the project, in particular, grantees continued to expand their collaborative relationships and engage other organizations to respond to emerging or newly identified trends of the families they serve. With certain types of member organizations or providers, grantees may have worked with multiple partners. For example, grantees serving larger geographic areas may have established partnerships with several different substance abuse treatment providers. And in these graphics, we only counted those partners as one time. Let's go back to that prior slide. And I think this is interesting to note the degree to which the regional partnerships engaged child and adult health services agencies are partners, as well as parenting and early childhood services. In the first year of the program, only 14 grantees, or 26%, included health services as a partner, compared to, as you can see, a little over 60% in the final year of the grant. The number of grantees with employment services providers and housing agencies as partners more than doubled from the first year to the last year of the grant. There's also an expansion of parenting or early childhood education services, and as we'll discuss in a few minutes, grantees expanded their services to children, including early intervention services and early childhood services over the course of the grant. What you don't see here is that the university affiliate evaluators were partners in about 83% of the grantees, many of which were the evaluators, the local evaluators for the regional partnership grants. This next slide, just to give you a snapshot of the number of adults, children, and families who were served by the regional partnership grantees. As mentioned earlier, Children and Family Futures with Planning and Learning Technologies and ICF Macro are responsible for developing a data collection system. And this represents the data that were uploaded by the 53 regional partnership grantees over the 5 years that the grants were in operation. It's really the single largest data set for families with substance disorders in the child welfare system. In a few minutes, Dr. Rohde will highlight the data from this data set in the next segment of the presentation. And this will just give you, this next slide will give you an idea of the broad categories of strategies and services that the grantees implemented. The grantees had the flexibility to implement a variety of strategies and services. There was no single program model that grantees were required to implement. There were over 20 of the grantees added, expanded, or enhanced family drug courts as part of their program strategies. And this just gives you an idea of really the scope and the breadth of services that grantees implemented in a full array. All the grantees implemented substantial service activities and strategies in combination, including residential services, in-home services, mental health services, and another critical component that we'll talk about in this webinar includes the collaborative practices both at the clinical level, direct services level, across child welfare, substance abuse, mental health, and the court systems, as well as systems management and collaborative program and policy activities, including the activities of oversight or steering committees. In this next segment, I want to highlight some of the key implementation lessons that we really learned from the regional partnership grantees. Our evaluation of the regional partnership grant program utilize a mixed methods approach. And I will highlight the results of our qualitative analysis of information obtained from a variety of sources. Grantees were required to submit semi-annual progress reports to the Children's Bureau every 6 months. We reviewed those reports and their final progress reports. We conducted grantee interviews with a small set of project directors, and then our performance management liaisons who worked with grantees throughout the course of the 5-year program reviewed those grantee reports, and their knowledge of working with the sites also enhanced our ability to collect this qualitative and analyze qualitative information about the regional partnership grant experience throughout the 5-year period. In these green boxes, you'll see some quotes directly from grantees that they shared with us over the course of their project, particularly toward the end of the program. Grantees stated that the collaboration they developed and strengthened over the course of the grant was one of the most important contributing factors to their overall success. It established a foundation on which to build other current and future community projects to serve families with complex needs who are involved in multiple systems. New norms were adopted as standard ways of doing business, and the partnerships established what they referred to as a culture of collaboration in serving child welfare families affected by parental substance use disorders. There are several levels of outreach that are needed in the work that the grantees did, both at a direct practice level. If you build it, it doesn't necessarily mean that they will always come. So engaging referral sources and other community partners who work with families with substance use disorders in or at risk of entering child welfare system really needed to be engaged early in the process and throughout the grant program. Letting community and or state stakeholders aware of the partnerships was also key in the initial implementation of the program, as well as keeping those leaders advised and informed of the progress the programs were making over the course of the grant. And this became particularly important as grantees developed sustainability strategies. Child welfare, substance abuse treatment, the courts and other systems adopted and expanded many of the practices established through the RPG project for all parents and children involved in their system or similar programs. As one grantee noted, our whole focus kind of changed when we got involved with our family drug court. Our federal project officer really gave us flexibility to listen to our partners and then modify our program to fill the gaps in services that were identified in our community. The grantee also noted that the flexibility allowed them to change to a different program curriculum, proved to be very successful for the population served. A number of grantees used NIATEX, which is a treatment improvement methodology to improve engagement and retention in substance abuse services, and a number of grantees use this quality improvement process to increase treatment participation and retention rates, decrease treatment dropout rates, particularly within the first 60 days, and reduce out-of-home care reentry rates. Over the course of the grant, grantees worked real hard to expand their array of services, to implement more family-centered services. And implementing family-centered treatment is challenging both from a client engagement perspective and a resource perspective. Meeting the treatment and support needs of family members requires partnerships and linkages to community resources that are beyond the scope of many substance abuse treatment agencies. And over the course of the grant, grantees moved from more individual-focused services, particularly a focus on parents with substance disorders and their partners, to more comprehensive family-centered treatment, particularly expanding services to meet the needs of children, both substance-exposed children and as well as children in the families who may have had needs for developmental and early intervention services. Broadening the partnership to include other community agencies was critical, as I mentioned in the previous slide, to securing important services, core treatment and supportive services. Not all the lead agencies were substance abuse treatment agencies, as I said earlier. So the partnering with substance abuse treatment agencies provided more immediate access to treatment services for parents with substance use disorders, and then partnering with other community resources, particularly for children's services, became pretty critical. And one of the strengths of the partnerships in being able to access those resources, and oftentimes not necessarily through purchasing, in fact, mostly through the efforts of collaborative work and partnership, that those families got greater access to a wider variety of resources than they would have had without the partnerships. As the RPG program progressed, the role of ancillary and support services in facilitating and sustaining positive outcomes only increased. Grantees noted the importance of mental health services, safe and affordable housing, and continuing recovery supports in particular. These next slides discuss the importance of being clear about roles and responsibilities, and delineating roles and responsibilities of partners is very important at both the direct services level and at the oversight or steering committee or management partnership level. Equally important is that families understand the roles and responsibilities of partner agencies who are serving families. One of the sites developed an information sheet for families that explained the role of Child Protection Services, the role of the Regional Partnership Grantee Lead Agency, who was also providing case management and in-home services, and then the role of the treatment provider, who was providing residential treatment services for moms and their young children. And that helped those families understand as they moved from child protection into the regional partnership program, into substance abuse treatment, how all of these systems and their staff worked as a team, and what the larger goal was in helping improve the outcomes for that family, helping those parents address their own recovery, as well as improve their parental capacity to care safely for their children. Grantees' experiences suggest that the communication and information sharing started with the RPG project helped lay the foundation for sustained collaborative efforts that extended beyond the grant period. Over the course of the 5-year grant period, the 53 grantees provided or participated in more than 6,000 training events involving more than 86,000 project staff and community partners representing child welfare, substance abuse treatment, the courts and other service systems and providers, and in their larger communities. Grantees who sustained their program generally were able to institutionalize and integrate RPG practices into existing systems of care. For example, 9 grantees achieved larger system changes, institutionalized RPG practices and services with system-wide implementation that went beyond the funded project, and we're going to talk a little bit more about what grantees sustained and how they were able to sustain those. And these sites integrated services, coordinated case planning, improved cross-systems communication, and shared agreement on client outcomes became the preferred way of operating. This next slide illustrates that one of the challenging contexts for implementation of the regional partnership grantees was the larger economic, climate, and fiscal environment that the grantees operated under after they were initially implemented in 2007. At the time of when the grants were implemented in 2007, the housing bubble hadn't burst, and we hadn't entered into the Great Recession, and those challenges impacted grantees substantially in their ability to sustain the projects, as well as to garner, maintain, and sustain participation from certain key stakeholders, particularly as those economic crises became more severe. And we'll talk about that in a little bit when I come back and discuss sustainability. And now I'd like to turn it over to Dr. Chad Rohde to present key evaluation lessons and some of the results of performance indicator measurement. Chad?
Thanks, Ken. Hello, everyone. I am going to talk, as Kim suggested, a bit about some of the lessons learned from the performance monitoring and program evaluation efforts with the first cohort of the RPG grantees. And before I do, though, I wanted to provide a little bit of context and to point out some important lessons that aren't often described in these kinds of efforts. And that is that most of evaluations and things like that focus exclusively on performance indicators, implementation measures, outcomes, and those kinds of things, obviously, all of which are critical. But I have to commend Ken and his team, because I'm coming late to this project, but Ken and CFF and others who have been involved and leadership from Children's Bureau and from SAMHSA in terms of thinking a bit about the evaluation itself. So the lessons learned here are focused on the presentation that I'm going to share is really focused on these two sets of findings. The first is related to implementing the evaluation, which is what I was referring to, that many folks skip over because it is not always articulated at the outset that these are important issues. Finding ways to gather the information, the implications for those processes, for the program itself, and how that information is used or can be used to inform program development. And the second set is a little bit more along the lines of what you might expect in terms of grantees' performance on those measures that had been identified at the outset. So with that, I'll start with the some of the lessons learned in implementing the program's performance monitoring system. And the first, for those of you that are most directly involved with evaluation, will take this as obvious, but I think many others maybe don't appreciate how important, especially in complicated projects like this, where maybe these systems had not ever shared this kind of information before. And you can see by the quote that is indicated in the green box here that that having the committing time and financial resources to the idea of sharing information is critical, not just to the success of the evaluation, but also to the effectiveness of the collaboration as a key element of what needs to take place in order for organizations to share other kinds of resources, such as staffing and training and other kinds of materials. Another key piece of what needs to be shared is what are people finding? So process and outcome data that can be shared in order for everyone to better appreciate what is the purpose of the project, how is the project performing, both in terms of its implementation, but what are the outcomes starting to look like, and figuring out ways in which that information can be shared was a key lesson learned by the grantees and those that were supporting their efforts in the field. You can see here in this quote that that certain data might be used, for example, in better informing processes and protocols around early identification and referrals, but the same can be true for issues later on in the trajectory of participants. Another lesson that was learned was that many grantees found that the data collection roles and responsibilities need to be clear from the outset, and all the partner agencies need to be brought on board at a point early in the process so they can appreciate that the expectations are not just at the time of writing the proposal for the grant, but also follow up with that with real effort to try and find out ways in which the way that data will follow through specific protocols for data sharing and so forth. And a lack of that really interferes with not just the abilities for these agencies and organizations to share this information, to comply with any federal requirements, but also in terms of sharing of other kinds of information about, again, the issues related to performance and so on. An important issue embedded here in that second box, which is not a quote, but is an important point, that about three-quarters of the grantees found data quality and other kinds of issues to be substantial in the implementation of their grant. And this is just an important point, not because it's unique at all to the RPG effort. And again, for those of you that are familiar with and have participated in similar program monitoring or evaluation efforts, this is an obvious but often unspoken issue, that the data that are collected and the analysis of those data not only depends on just getting them to the evaluators and the evaluation team or cross-site evaluator, but constant and systematic monitoring of the quality of those data over time. So that was an important lesson learned that gathered through the first cohort. Looking at the importance of qualitative and quantitative data. So most of the performance monitoring, like other GEPRA-driven data collection systems that are used by many federal agencies, they have key quantitative outcome information, but as most of us can appreciate, there are lots of compelling qualitative information, not just for the anecdotes such as what we've highlighted in these green boxes, but also the importance of the mixed methods approach to gathering the full multi-dimensionality of the efforts, and also for being able to communicate those efforts to one another in ways in which the audiences can better understand the full vision of what's happening, the full vision of what is occurring through the grant, but also about what the participants are experiencing that can be that oftentimes does not come through as clearly in the quantitative data. But together, clearly, those are both qualitative and quantitative measures are critical. And as Ken alluded to earlier on, in terms of the ways in which information was collected for this project, they really reflect this effort. That the performance measures that I'm going to be talking about in a minute are really complemented by site visit notes, other quarterly and biannual reporting to SAMHSA, interviews with project leaders, and so forth. So another important point here is looking at the complexity of getting the data and thinking about the different methods that are going to be best matched to the program interventions and the community that the grantee is serving. So thinking about a key lesson here really is thinking through how the instruments are tailored, can be better tailored to the programs and the services that are being implemented. And so, for example, one grantee whose target population was women involved with the child welfare and criminal justice system did a retrospective study on their program's use of the trauma symptoms inventory, and they concluded that the standardized trauma assessment measures really need to be reviewed for their appropriate use with the intended population, and then identified important considerations for and limitations related to the inventory that they had selected. And so, of course, it's not to suggest that the inventory itself is problematic, but that those inventories are intended for broad populations, and when thinking through what will work in a specific setting for specific participants, that it may imply or indicate that changes need to be made, and evaluators and others on the team need to be prepared to make those changes as they're appropriate, and not just assume, again, that just because something was proposed at the beginning, that is exactly the best long-term solution for getting the important information. The next slide really relates to the underlying logic that's related to the performance measures that I'm going to be talking about. So I'm switching now away from lessons learned about evaluation in the broad sense to lessons learned that can be derived from the data that were collected through the performance monitoring and evaluation efforts of CFF. So as you can see, and as with a typical logic model, this is a little bit detailed, which I think is helpful for those of you that take time to read through it. I'm not going to at this point. But you can see that there are basically 4 co-components associated with the implementation of the program. The first relates to adult services. The next is with children's services, child services. And the next are related to the families, to the parenting and family services. And then finally, efforts to implement collaboration. And you can see in the green boxes just some really high-level findings related to each of those efforts. And I'm going to get into more detail on all of these. But I think an important takeaway from the slide is how complicated and diverse these projects were, which is both exciting from the standpoint of learning a lot quickly from a lot of different communities, but also complicated in terms of finding meaningful measures across all of these domains, dimensions in all of these different community settings. So the challenge that continues now for under the second cohort, and we certainly resonate with on the first cohort, is trying to find meaningful ways of not just collecting these data and using the lessons learned that I just described, but also ways in which those data might be best interpreted and taken into account that these grantees were implementing their programs in very different ways with many different communities by design and with the oversight of SAMHSA and Children's Bureau and with the support of CFF technical assistance, but also those insights can help us understand and interpret the data that are drawn from these different performance indicators. So turning now to those indicators, grantees developed performance plans that would indicate which of a large number of indicators might be chosen that would be best matched to their implementation plan. So again, returning to what I was just talking about in terms of the grantees' diversity of strategies and diversity of communities and so forth, there was an effort undertaken early on to find those indicators that would be best and most reflective of grantees' efforts and most appropriate to what they were implementing. And so as you'll notice, although I'm not going to spend a lot of time focusing on it, the different indicators are derived from different numbers of grantees with different proportions of their participants, depending on what those appropriate what was most appropriate for those measures. And I'm certainly happy to either at the end of this or through follow-up communication to talk more specifically about the different underlying measures that, or excuse me, yeah, the different underlying measures that contributed to each of these indicators. So very encouraging for the efforts of grantees. Most importantly, perhaps, especially for many of us, would be the message that grantees, through their efforts, were able to keep children safe. And so a highlight of that is that more than 90% of the children who were in custody at the time of their enrollment, they stayed home. And another important lesson here, and this comes up in a few places throughout the performance indicators, and I think it's an important message from the grantees, which was performance improved over time. So grantees, as the collaboration that Ken was describing, improved over time as the data sharing and information sharing and service alignment and coordination improved over time. Those improvements were really reflected in many of the indicators, and this is an important point here. As you can see, in year one, 85% of kids who were at home and stayed home throughout program participation, 85, and it moved to more than 96%, either of which are important and positive indicators. But what's also important to note here is there was a more than 11% increase. And also important to note that in terms of safety is that only, well, I mean, as it goes without saying, of course, that no recurrence is what we're all looking for, but 4.2% is certainly outperforms many other national measures of repeat maltreatment. The next encouraging finding from the performance measures was that households remained stable and stability improved. So again, skipping down to the issue of improvement over time, reunification increased from 55% in the first year by almost 20% to more than 72% in year 4. So again, grantees were developing and learning over time, and performance improved over time from a fine number to really a quite good number. So both in terms of absolute outcomes and improvement over time. And then, unlike many other measures, for a large number of children, we were able to track them over 24 months following reunification, regardless of whether or not they were still enrolled in RPG. And we found that only 7.3% of children who had participated in the RPG program re-entered foster care following reunification. So the another sort of caveat here is just that many of the grantees, in fact, some of them had no reentries, but only a small number of grantees experienced higher rates of reentry, which sort of skew these data. In other words, about 2/3 of the, 3 grantees are responsible for about 2/3 of the reentry. So this rate here is distorted a little bit about grantees that may have been serving higher risk families involved at a deeper level in the system, or their program design was such that their systems may have been set up in a way, or the context may have set situations up in a way that they had higher rates. But again, important to consider how stable these families were kept, and families were staying home and reentering foster care at very low rates. So the next slide is just a summary of much of what I've just related, but some of which are stated somewhat differently. For example, if you're looking at those that were reunified in less than who reentered foster care in less than 12 months, you can see that when I was talking before, I was talking about the 24-month rate, and the 12-month rate is 5.1%. Another thing to point out about this slide is there is an effort to provide some contextual information, not a true comparison by any means, but to provide some context, a point of reference by which the performance of the RPG grantees might be measured. And you'll see that on virtually every one of these measures, that the RPG programs outperform that which was occurring in the states in which those grantees were operating. One important finding that we're looking forward to exploring a bit more in the future is the issue of discharge to reunification. And you'll notice on the second row of data on this slide, the discharge to reunification took somewhat longer for those children enrolled in the RPG program, which at first glance might suggest that there is an issue or a concern about those families. However, one might also imagine that this is an important measure of the level of involvement the level of support that family is getting, and so that children are not being reunified until the parents are getting to the point of recovery or other safety issues are resolved within the family, and then they're being reunified. Because as I related earlier, once reunified, they're staying home. And that might be in part because the families are getting services for longer periods of time, and that might help explain the longer period of time in foster care. So again, there's going to need to be some additional analyses and interpretation for us to better understand exactly what's going on. But we suspect that there might be some positive interpretations of some of these where the data aren't as clear. Elsewhere, you can see that the data are very clear. Again, looking at reunification and reentry, the rates being just less than a third of, just a little bit more than a third of what was occurring in the states in which the grantees were operating. So moving a bit to a couple of different measures now that I'll conclude with, and they're related to recovery and well-being. These had a multidimensional set of measures, some of which were related to the direct performance of the participants in terms of how well they were doing or how well the families were performing in some direct measures. But another important measure that I'll describe a little bit and comes up in recovery and again in these well-being measures is the extent to which the participants were getting the kind of comprehensive services that we understand from the literature and elsewhere that these families really need, the coordinated and deep care that they need from lots of different areas. So I'm going to go through not just their performance, but also their access to these related services. So the first point here is that the parents were accessing treatment quickly. They were staying in treatment, and many completed treatment. And other important background information for this, for many of you, might be to understand that about a third of those adults were in treatment as their primary substance was methamphetamine. And going back to kind of Ken's history of the project and thinking about the time in which this project was being implemented, that was really at the forefront of the issues that many communities were facing. And the RPGs then were really focused on those families impacted by methamphetamine, although, of course, many were looking at other issues, and including marijuana, alcohol, heroin, and so forth. Also an important point for understanding this is that, like the rest of the RPG program, they primarily served women, including 3/4 of the women who were coming into treatment, which is about the same rate at which they're in the RPG program overall, accounted for 3/4 of the total population in substance abuse treatment. And also an important point is that almost 8% of them were pregnant at the time of treatment admission. So they're serving an important population when you consider the health of families. So then looking at some of the outcomes related, some additional outcomes related to parental recovery, that we saw substantial reductions in substance abuse, important improvements in employment, and reductions in criminal behavior throughout treatment. So if you look at all these different dimensions of healthy families, you can see that virtually everyone that was measured showed important, if not statistically significant, improvement. Now to look a little bit, as I alluded to at the beginning, about the importance of looking at supportive services for engaging families in care and also for sustaining their improvement. And you looked at grantees were able to not just refer families, but actually screen, assess, and then connect them with services at very high rates, starting with sort of continuing or aftercare, transportation, parenting, and so forth. All right, the next set of measures are really about improving child well-being, and again, the findings are pretty convincingly positive in this regard. So looking at least one measure of family strength, that that where child well-being was rated as strength of the family increased, it almost doubled from 24% of the families at admission to 53% at discharge. And you can see that similar improvements carried forth through for overall well-being. And then looking at, perhaps very importantly, that the greatest gains were in the area of children's mental health, their behavior, and the relationship with their parents. Again, all really crucial to the success and health of the family. The next table, again, summarizes with some more detail the improvement from admission to discharge on a subset of the outcome indicators. And again, the ends don't approach the full size and scope of the program, but relate more to the number of grantees who are implementing a specific data collection assessment tool called the NCFAS, or North Carolina Family Assessment Scale. All right, and then again, just as in the adultish recovery domain, in child well-being, there are important measures of the kinds of services that grantees were successfully able to screen, assess, and connect families, and you'll see that there are high rates of substance abuse prevention and education, which all of us can appreciate because of the intergenerational nature of many of the problems that these families are facing, and that grantees recognize that issue and were able to intervene at an early prevention stage for the children of the adults that were already facing these challenges. Obviously, we know these children were also facing primary health care challenges, and many of them are coming with educational or developmental problems, and so the rest of these services were also the children who needed these services were connected with them. Looking at adult well-being beyond the issue of recovery, the measures indicate clearly that parenting strategies, that parenting capacity improved throughout the across grantees and improved throughout the period of implementation. And you can see pretty dramatically, even more so than in the children's domains, that strength improved in terms of parenting, in terms of parents' ability to nurture their children increased from 14 to 46%. And again, that where this represented a problem decreased by more than half. And again, one of the key lessons here is that when parents are recovering, when parents' use of substances goes down, they can improve the supervision of their children, and their relationships improve as well. So there's a clear relationship suggested in these data that we need to be paying attention to the issues of parents and how substance use interferes with their ability to provide for their children. We also looked at family well-being, and again, looking at all of the dimensions, we noticed that there are important and statistically significant findings in terms of improving from admission to discharge, family interactions, the safety of the home environment where the children live, and family safety. And so if you think about our other indicators in terms of the child safety, family stability, and all of those indicators, that they are interactional, that those measures that suggest that families were stable, they were stable because they were able to improve their housing, their access to services, and all of the related services in addition to substance abuse treatment that created, that addressed the multiple needs of these families and led to some of these important outcomes. So just to summarize, that the majority of children who are at risk, they stayed home, they were reunified quickly, and the parents and the caregivers received access to substance abuse treatment. They stayed in treatment longer, and other indicators of successful recovery improved during their participation in the RPG program. Again, in sum, that well-being, that adult, child, and family well-being improved from program admission to discharge, and that grantees improved over time and don't yet appear to have hit any kind of ceiling in terms of their ability to find these improvements across all of these very difficult to serve families. And so with that, I will turn it back to Ken to talk some more about what lies ahead.
Thanks, Chad. All right, this final segment, I want to talk about sustainability. Before I do that, I want to kind of reflect where we've been. And as Elaine mentioned in the beginning of the presentation, Congress required the Department of Health and Human Services to do a couple of things. One was to develop partnerships with child welfare and substance abuse treatment providers. So I described the composition of those partnerships, and we share with you the lessons and experiences that the grantees had with implementing those partnerships and sustaining those partnerships as well. And the impact those partnerships had on providing direct services to children and families, as well as systems level collaborative work. The second area that Congress required of the department was the development of a set of performance indicators through broad consultation with the field and grantees. The Bureau accomplished the consultation part of that actually before the grants were awarded, and Chad just described those performance indicators and the results of that. It was extremely challenging, and the grantees really need to be commended, because in order to do what Chad just presented, grantees had to collect substance abuse treatment outcomes from their partner agencies and/or county or state treatment information systems, as well as collect child welfare outcome data from their local child welfare database or their state SACWA system, and combine those into a database, a local database, and then upload those into the data collection system. And you saw the numbers that I was speaking of earlier in terms of the largest data set. So it was quite an effort that the grantees engaged on for a services grant that, as Elaine mentioned, was not a cross-site evaluation in Regional Partnership 1. So the next thing I want to talk about is sustaining these partnerships, why that's important. I think all of us who've done this work, all of you out there who continue to do this work, would agree that these grants, 53 and now 17, were really too important to be treated as just projects that come and go. The Bureau emphasized the importance of sustainability in their original funding announcements, and probably most importantly, it's not fair to families and communities to have quality projects like regional partnership grants come up and be implemented and then disappear at the end of grant funding. So from the beginning of these projects and these programs and our role with technical assistance providers, we really emphasized the importance of sustainability planning, and that was reinforced by the Children's Bureau really from the very beginning of these projects throughout the projects. And the grantees who are on this call, on this webinar, will bear with me. And as we've said, for these 5 years that we worked with these sites, good sustainability planning is like good treatment discharge planning. That really has to begin at the beginning of a project, and in the treatment scenario, certainly good discharge planning occurs shortly after admission to a treatment agency. And so we worked in partnership with the grantees on sustainability strategies, and we're excited about the outcomes of the work that the grantees did regarding sustainability. And I mentioned earlier the environment, both the economic environment and the fiscal climate, how challenging that became after the first year of implementing these regional partnership grants. And we'll talk about the barriers, but you'll see that the outcomes sustaining these projects is really pretty remarkable in that context. So some of the barriers that the grantees experienced was the lack of in-depth collaboration and relationships with key stakeholders. The challenge with engaging state agencies and key leadership stakeholders was directly impacted as the recession grew worse, and the challenges to budgets and the challenges to that climate presented, often resulting in staff reductions in partner agencies that in some cases impacted referrals, but also impacted partners and leadership partners' ability and availability to engage in sustained sustainability planning. As I mentioned, some of the turnover in frontline staff also affected challenges with receiving referrals from time to time over the course of the grant, again impacted when certain systems experienced budget cuts through the recession. Staff turnover was also a challenge over the course of the grant, not unusual in human services systems to experience turnover at the direct service level, and then as in some agencies, and particularly state agencies, when high leadership such as the commissioner or secretary turns over, that often presents challenges for the ongoing implementation of a program such as this. But despite some of these challenges that were very real for grantees, they achieved a substantial level of success with sustaining at least part of their collaborative activities. So on this next slide, you'll see in the upper left-hand quadrant refers to the services and activities provided as part of the grant, that almost 3/4 of those services and activities were sustained. We implemented a program strategy confirmation process throughout the course of the project. We did that about 3 times over the 5 years, and really to determine what services were being implemented, how they were modified, and as you see here, what services were able to be sustained. And then in the upper right-hand quadrant, you see that over half of the grantees, now these percentages in these next 3 quadrants represent the number of grantees, or percentage of grantees. Over half were able to sustain specific components or scaled-down modified version of the program. These slides do refer to the 44 regional partnership grants whose grants were not extended. There were 8 grantees who received 2-year extensions on their original 5-year grant as part of the second authorization of the regional partnership grant program. Equally impressive is the fact that almost a little over a third of the grantees sustained their project in its current form or model. And by that we mean the shape that the form that the project had at the end of the final year of the implementation of the grant program. And about 5 grantees were not able to sustain any part of their program. Family strengthening services, children's services, and substance abuse and mental health treatment and linkages were the program areas with the greatest likelihood of being sustained, as well as the collaborative partnerships at a systems or management level. In our role as the technical assistance provider for the Regional Partnership Grant Program, we use this model of the stages of collaboration that was developed by Sid Gardner, the President of Children and Family Futures. We used it to work with grantees to move beyond project funding, as I just mentioned. We all viewed this work, and I think the Children's Bureau as well, as critical to be able to sustain, and it's too important to treat as a project that comes and goes. So we use these stages of collaboration to work with grantees to understand how far they could move and to move beyond just considering this as an externally funded project, and to move to the latter 2 stages of collaboration that would enhance the sustainability and the likelihood of sustaining at least part of their regional partnership grant programs. And as you'll see, grantees achieving higher levels of collaboration had substantially higher rates of sustainability than those grantees at lower levels of collaboration. On this next slide, on the top of this graphic, where we talk about 90.6% of the grantees moved to more advanced stages of collaboration. We're speaking to those next 3 levels of collaboration beyond basic information sharing. Some of the facilitators of sustainability that grantees convey to us was the importance of experience and consistent project leadership. We're able to demonstrate the effectiveness and results of their outcomes using data to inform stakeholders early in the process. Early in the grant process, it tends to be more process data, and then using data to inform leaders and stakeholders regarding their outcomes. And the ability to identify and engage key leadership and stakeholders in sustainability conversations, both early in their program and then certainly in the latter stages of their program. And as you can see here, 17% of grantees were able to institutionalize their RPG practices and services with system-wide institutionalization. Clearly, the level of collaboration were associated with grantees' capacities to sustain their program. Of the 5 grantees who were in the preliminary stages of collaboration, information exchange, only 2 expected to sustain and were able to sustain all or part of their models. All 7 grantees who had attained the most advanced level of collaboration, i.e. that 4th level on the stages tier, changing the systems, expected and had sustained all of or part of their program model. Some of the financing strategies that grantees employed, you'll notice that there's a range of strategies here that go well beyond just looking for another grant to fund the project in and of itself. Most of these strategies speak to incorporating or integrating the project services or changing current practice to institutionalize these services. This included being able to do third-party billing, and by the end of the funding period, nearly 1/3 of the grantees had established a mechanism for third-party billing. One of the tribal grantees sustained all of their program services through creating the capacity to implement third-party billing during their RPG project. We're running a little low on time, so I'm going to move through these fairly quickly. In the next segment, I'll talk a little bit about cost studies. This was not a requirement of the regional partnership grants. Most of the grantees did not include cost studies in their local evaluation plans, but as we discussed sustainability, we discussed the importance of being able to demonstrate some level of cost effectiveness, certainly being able to identify the costs of the program, and to the extent that the evaluation would support the capacity to show were there any cost of all savings associated with the achievements, with the outcomes that grantees experience and were able to demonstrate. And so even though it wasn't a requirement, there are about 1/3 of the grantees did a cost study or were in the process of conducting a cost study in the final year of their project. And I'll move through these fairly quickly. So this demonstrates that over the course of the project, an estimate from one grantee demonstrating a cost avoidance by reducing out-of-home care costs. Let's move to the next one. And these are from 3 different grantees who implemented cost studies. The Strengthening Families Program cost study at the top of this slide. You'll see as a result of that implementation, children spent 190 fewer days in out-of-home care. This study was published in the Children and Youth Services Review. It was done by Johnson and Motoyama, Jody Brook, Yan, and Tom McDonald, and was published in November in 2012 in the Children and Youth Services Review. And you see most of the savings associated with these programs related to reductions in out-of-home care, length of time in out-of-home care and foster care. In this middle part of this slide, actually fewer dependency petitions being filed as a result of diverting from a court process. I think in the interest of time, let's move through to the summary slides, Melissa. Okay, putting together, kind of summarizing what these grants accomplished and what they continue to do when their grant periods ended. They continuously evolved and their partnerships expanded and matured over time. The engagement of the core partners was essential to the overall success, meeting the complex needs of children and families who required more intensive services and for longer duration, and required greater access to those services through these partnerships. To build and sustain these necessary cross-systems collaborative infrastructure requires a shared commitment of both financial and human resources. The payoff of this investment was increased access to a broader array of services, often supported by other community resources rather than the grant, and new ways of doing business beyond traditional system silos. Staff training and development was a key project component. We know that our systems tend to experience a fair degree of turnover, and that not only the initial implementation and staff training, but ongoing training and staff development was really critical for the continuation of these projects, not only during the program grant period, but afterwards as well. And it's particularly critical as we saw programs implement evidence-based practices and maintain that infrastructure to keep staff trained in the implementation of those practices in light of the challenges with staff turnover. We talked a little bit about the use of data and the importance of using data throughout the course of these grants, certainly to increase the awareness about the complexity of families' needs. A number of grantees looked at the ACE study and the ACE profiles of their participants and demonstrated, again, the complex needs and the backgrounds that families brought to these projects. And then the importance of using data to communicate their program's effectiveness. Successful evaluation was a key component of RPG 1 and RPG 2, as Elaine mentioned, through the cross-site evaluation, even takes it further. Go ahead, Melissa. Let's move forward to this slide right here. So, considering the promising results reflected in what we've talked about today, and the performance measurement of the RPG grants, the level of collaboration that most grantees achieved, and the extent to which most sites are sustaining their services and collaborative practices and activities through their interagency partnerships and collaboration, the RPG programs clearly enhance the well-being of children being served by these programs, led to increased safety and permanence for children, oftentimes through the interventions, most of the time through the interventions that their parents received, as well as the parent-child interventions that their families received, as I mentioned earlier, including family center treatment services, decreased or prevented out-of-home placements, and had an impact on maintaining children in their home or returning children to their caretakers in a timely fashion. And then improve the capacity of parents to care safely for their children, and expanded the regional capacity of these grants of these jurisdictions to provide timely and effective access to treatment services and children's services for the families that were being served by these projects. And with that, I'd like to turn it back to Elaine.
Thanks, Ken, and thank you, Chad. I think at this point, you know, Melissa, if you move to the next slide, we really just wanted to have the opportunity, although I know it's not a lot of time, but to talk about what's next. And as Ken said earlier, we do have annual reports to Congress. The first 3 reports to Congress are available from the Children and Family Futures website, and if you would like a copy of them, you can also reach out directly to us. The 4th report is currently in clearance, and we also hope to make available the RPG program briefs that have been developed. But the other exciting news that I just wanted to say on the phone is that there is an opportunity for a round 3 of the regional partnership grants. And so we hope that if you have questions about that, please contact me directly, and more information is available on that on grants.gov. But as you can see from the presentation, we think that there have been many accomplishments from the RPG program, and we can round 1 program, and we continue to build on them through RPG2 and look forward to RPG3. And so with that, I just wanted to check in with Melissa to see if there are any questions, or to encourage folks to submit questions through the chat function now.
Hi, Elaine. It's Nancy Young. And I think for the questions that came in through the chat box, we responded individually. There were some specific things about measures and some follow-ups related to the way that some of the performance measures were operationalized. I think we've answered those questions that came in, as they were pretty specific, but would encourage anyone on the webinar today to send an email. You'll get an email. Well, here are the addresses, and particularly to Ken DeSergio at cffutures.org with any follow-up questions that folks may have, and we will post these questions and the answers with the materials on the website.
Thank you all. We appreciate your time. Thanks for joining us, for being with us for this last hour and a half, and we look forward to hearing from you. If there's any way that we can help you answer any additional questions you might have in the Regional Partnership Grant Program, but also to assist you in your collaborative practice to better serve children and families in the child welfare system with substance use and mental disorders as well. With that, Elaine, back to you.
Thanks, everyone. And again, thank you to Ken and Chad for their presentation as well, and we look forward to hearing from you in the future. Thanks again.